Hello and good evening to the Black Belt Academy of Surgical Skills. My name is David Regan. I'm a cardiac surgeon in Yorkshire in the United Kingdom, and I'm the director of the Faculty of Surgical Trainers for the Royal College of Surgeons of Edinburgh. The title for tonight's talk is Assisting a Dance Pavane. Now, pavane was the 16th century slow procession dance. It was deliberate and moderated and choreographed. It sums up the system. I remember years as an SHO standing holding a diva retractor for open cholecystectomies. Now, this is an incision underneath the costal margin on the right, and the diva retractor was a curved bit of metal with no handle and very hard to grip. And you had to hold it and hold the liver out the way to allow the surgeon to get to the gallbladder. It was a painful operation because the handle was difficult to hold and you could not see what the surgeon was doing. Now, assisting for many people is exactly that. You cannot see what the surgeon is doing, but not so with laparoscopic surgery. But I'd also put it to you, do you really go into theatre to look and learn and watch? And do you really observe? Or are you thinking of all the other things? And it reminded me of an annual that I had when I was 14 called Look and Learn. And that's exactly what you should be doing when assisting, is looking and learning. Moynihan said that surgical experience is a posy of other men's flowers. And it's important for you as a trainee to have a look at all the tips and tricks that the surgeon's employing to develop tissue planes and to advance the operation. They might not be obvious, and to the surgeon and the expert, all these tips and tricks are tacit. And one of my concerns are that expert surgeons are not very good at making some of this explicit. So I want you, when you go in to assist for an operation, to actually understand what the operation is going to be about. Know some of the anatomy, have some questions at hand to ask during the operation as well. It's interesting, I'm comparing assisting to dancing, and we have actually asked dance instructors what makes a good partner. And a good partner understands the dance, flows with the rhythm, intuitively understands the next steps and moves, and actually enables the lead dancer to move the movement. And that is exactly what an assistant in surgery should be doing. Likewise, the surgeon cannot do the operation by himself or herself, and it requires an assistant, at the very least, notwithstanding the scrub nurse, the perfusionist, the anaesthetist, and all the other 10 people in a cardiac theatre. So surgery doesn't happen by yourself. There's no I in team, and it's important that you have your team choreographed and working with you to deliver the operation. And there's some certain principles involved. Now, at the Black Belt Academy of Surgical Skills, we emphasize the importance of the height of the table. But the height of the table is all very well for you as a surgeon. Because taking an iron, you would set the table automatically at a height that's comfortable. You will not take an iron up here, nor would you iron down there. But have you considered what it's like for your assistant to assist you? So this evening, I'm delighted to be joined by my son, who's 14, the age I received that annual. Alistair, please join me. Come into the view. So Alistair and I, we train in karate together. And there's 14. I'm sure he's almost as tall, if not taller than me. But he understands in martial arts that it's important to get the correctness right, because it's the attention to the detail and the correctness that will allow the movement and the flow to then develop. So I'm going to introduce you all. Alistair, have you ever been in theatre before? No. No. I'll introduce Alistair to some basic surgical techniques to help him understand the importance of a system. So, stand up with me, shoulders parallel, come closer, shoulders parallel. So the first thing to see, is the table the right height for Alistair? And yes, it is, with similar heights. Now, if I was shorter than my assistant, I would need to stand on a stool. Likewise, if my assistant was shorter than me, they would need to stand on a stool. But in the last 2 years, one of my trainees was 6'5", so he was a head taller than me. And what he noted was I was the first consultant to stand on a step, to take the table to a height that he was comfortable to assist me. That's interesting, isn't it? But if you are of a taller disposition and finding it difficult to reach down, then I suggest you take it as a giraffe. You take your legs out laterally and spread them, but the problem is then you're limited in turning. But at least then your back, your shoulders, and your neck are relaxed. Preferably, do ask the surgeon with their mind standing on a step. This is very important if you're going to be on the table for a few hours, that you're both very comfortable. So, assisting is like dancing. I'm going to put my hands on Alistair's shoulders, all right? And if I move to the right, as I've described before, I need to do on certain movements. And if I move to the left, and then you got it. So at all stages in this operation, Alistair needs to keep his shoulders parallel to mine. Parallel, all the way around. There you go, and back again. All right? Now, that is the midline. Midline across the table. It's important that you don't reach across the midline. So even if I'm there, imagine the midline is now changed, is now across this direction. And you don't reach across the midline. This way, you can understand the midline between us is now there, and again, you don't reach across this midline. So the midline, I just put a string, is moving parallel with our shoulders all the time. There might be a subtle movement, or it might be a gross movement, but at all stages, the midline is between and parallel to our shoulders. The next important thing, the operative area indicated on this plate by the small plate, is where my hands and instruments are. And usually this was in the bounds of a retractor, whether it's a sternal retractor or abdominal retractor. My hands are in the middle. So Alistair, you put your hands on the outside. So if I move round, Alistair's hands stay on the outside all the time. And stay on the outsides. He never reaches across midline. He never puts his hands in the field of view. And I recall working for Stephen Westerby. I nicknamed him Steven Spielberg Westerby because he made some of the best films for ascending aortic conduits. But the camera was always at the top. And he was always aware of the best view coming up. And if your hands got in the way, you were reprimanded in no uncertain terms for ruining the film. But it was a good lesson. I never reached in or crossed the midline. So, as we've got here on the plate, we've got the 12 hours of a clock. You'll recall, as we're stitching around the clock. So I'm going to pretend to stitch and you're going to hold. Now the important thing is when holding, you see this bit of string, I need enough to actually make the stitch, and therefore it needs to be held sort of 1/3, 2/3, all right? Or maybe, so there's space. I do not want to be tripping over my suture or loops because the suture is not held out. Now automatically, you'll notice, and I'll bring it round this side, that I've held the suture between the finger and thumb. And it's important to hold the suture between the finger and thumb, because if I do not say let go, or you forget to let go, and I pull the suture through, it's not going to be caught on your digit as it's pulled through, and therefore tear. If it's between your finger and thumb, in the direction it's being held, all right, and I pull it, at least it comes free and is not going to cheese wire or pull on the tissue. So all the way round, when I'm assisting, not only does your body position have to be right, you need to be holding the suture at the right length and following it appropriately all the way around. So should we try that, Alistair? So right, finger and thumb, excellent. A little bit further out. Now, another surgeon I worked for used to say it's a lateral hold and not a pull. And that is exactly it. The surgeon takes out the suture on the tension and the direction that they require. Hence, like that. And I'm going to take it out according to these directions. Okay, so let's go, shall we? So pretend to take a stitch, let go, hold it up again, there. Excellent, take a stitch, let go, maintain this tension naturally, and I should hold it out for you. Okay, and I'm going to come round, as I'm coming round, move your shoulders, remember, with me. Keep the tension, okay, let go, now pull it through, and that will come up. This model, of course, is exaggerated to enable you to see what we're doing. Up, okay, there, up, hold it out, there, and now I'm going to go backhand, all right? Come round, remember, as I described before. So come to see if Alistair does it intuitively, all right? Remember, you don't cross your hands this way. So let's see if you remember intuitively. This way, good. You're not going to bring that hand across midline. You're now going to swap over to the next hand, all right? So at some point in assisting, you'll need to swap from right hand to left hand to ensure your hands do not cross over. So let's do that again from this side, and up, and out, and follow, good, up, and out, keep the tension, finger and thumb pointing along the vector that's come out. Surgeons maintain the tension, it's a lateral hold and not a pull, and you're holding the tension. This side, come out, and up, all right, and this side, keep the tension, important to keep the tension, well done, you go, and up, and we're going to come out, all right, take that out, well done, and you begin to get this way, and up, then, now, this is the angle where I need to turn around, and I'm going to go around beforehand now, and automatically the assistant has changed position. Excellent. So now you can hold, which hand you can hold with. Very good. There you go. Because we're not going to be crossing our hands. So there you go. Up and hold. Okay. Hold it up. Very good. Up and hold. And there you go. Up and hold. Okay. And this way again. Up and hold. And you're crossing yourself. So you've got to. So do you understand the principle? Sort of. The simple principle is you're not crossing your hands, you're not reaching across, and you're moving your body around with me all the time. You want to try that for real, yeah? So let's try this and go bananas. So remember, our favorite exercise is stitching the banana. And there you go, banana stitching. So here we go. And this is a monofilament, as you can see. And if pulled tightly through the banana from our previous lessons, you'll appreciate that this would cheese wire. So this is part of the black belt level for assisting. Can you hold the suture out appropriately at the right length at all points on the clock without tearing the banana? You might think it is easy, but it's not. Okay, so I'm going to occupy one of your hands with a pair of forceps. Okay, all right. And I am going to I had a little bit of put something down here. I want you just to pretend you're holding something. And I'm going to put that there. I'm holding that. Okay, now you're going to follow. All right, so I'm going to take a stitch to the banana. Okay, I'm going to take it out. Wait for me. And there you go. There's a lateral hold. Perfect. Finger and thumb, lateral hold. All right. I'm going to come towards me. It's easy as stitching towards yourself all the time. Well done. And you've moved your body around. Well done, Alistair. Okay. And let go. I didn't have to hold that again. I'm holding the tension. Just hold it out a little on the vector. There you go. This plate gives you an idea. All right. There you go. There you go. Okay, hold that. Keep it out in the direction. And the lateral hold, come around a bit further. Okay, that's all right. There you go. Well done. And keep a bit more tension on that suture. Because the assistant is not pulling, you're maintaining the tension that the surgeon has actually asked. A bit more tension, a bit more laterally, please. Okay. Some suture. There you go. All right. Now I'm going to go backhand. So what do you, whoopsie, okay, there's a knot in that. Okay, pull it through. Okay, I understand what you're going to be doing. Okay, excellent. See that? Intuitively, he immediately put the forceps into the opposite hand, and now finger and thumb holding it again, and has moved his body round. Okay, just hold the tension a bit more, please. Now I'm going to ask Alistair for way of an example. In the next stitch, not this one, please. The next stitch, okay, and pull it through. Okay, hold it out laterally, please. Further down, remember 1/3. I've got to have enough room to actually use the suture. There you go. So you can imagine that this, like dancing in particular, now don't let go and let me tug it out of your hand, all right? Because I want to demonstrate something. Okay, very good. Now that will develop, and you might have seen that that is going to cut out the banana. So, you can bring it up to the camera, and you can see there, the sutures were radial, but actually when it caught the finger, it quickly ripped the banana. And that is what's going to cause a problem. So this requires practice and rehearsal. Practice and rehearsal. Another way to do it is when this, to make it more complicated, you'll see in my previous lesson, I put staples at the 4 corners. So the assistant is pretending to retract by holding the opposite staple without pulling it out. You see there, starting to develop the tear in that banana. It is deliberate. It is a deliberate movement, keeping the midline between you, keeping your shoulders parallel all the way round, and finger and thumb. Funny that finger and thumb is a clear message throughout all our lessons. Finger and thumb. Now, there are just two other things. We've talked about use of the forceps before, and you need to practice the holding of the forceps with the lumbricals, right hand and left hand, and be confident picking things up with both right hand and left hand. The other important thing, I'm going to ask you, could you cut that suture 1 centimeter for me? Alistair's never done this before. Let me just turn the scissors around. All right, and use your scissors. Okay, 1 centimeter. Okay, good. Now, as I expected, the important thing is stabilize the scissors, never open them up further than necessary to do the job, and you should be able to cut 1 centimeter. Put it in, cut, take it out. Don't take it in from behind the lights, swoop in, flourish, cut, and take it away as you fly out of the operative field. Because that too will actually tear the tissue and cause problems. So there you have it. Some simple principles in the system. And you do have to look and learn. I remember helping a professor in cardiac surgery do a homograph. And I was standing there watching him stitching this in, and there was a little bit of tension in the air. And I was watching it and thought to myself, it doesn't look quite right. But how do I bring it up? So I asked the question, Lisa, could you just tell me how you aligned this homograph? Yes. Yeah. And we carried on stitching. Some 15, 20 minutes later, the surgeon then replied, I now understand why you asked that question. And we had to take the homograph out and start all over again. To my mind, the assistant is critical to an operation. It's somebody there to keep you in check and watch. Very importantly, certainly when doing a coronary anastomosis, I'm standing on the right anterior oblique. I can only see it from this angle. My assistant is standing on the left anterior oblique. And if you think that all chest x-rays are done at 90 degrees to give you that 3D perception, your assistant is critical to helping you with that 3D perception because they're seeing the field from a 90-degree angle opposite. Now, I prefer to have an assistant doing coronary anastomosis wearing loops so they can actually see my anastomosis and call out if it doesn't look right. I do say to them, if it doesn't look right, please tell me. And sometimes I deliberately put, or attempt to put, a bad stitch in to see if they're on their toes. That's my excuse anyway, and a little trick. But your assistant is critical to your flow and rhythm of the operation. And not many surgeons are very good at describing how to assist properly. This evening's lesson was focused on the basics, because I believe we don't teach the basics, and unless we get the basics right, we will not progress. I hope this has made sense to you. We've had a little bit of technical problem this evening because I usually run this off my smartphone, and although I had 4G and I had internet connection on my smartphone, Facebook was saying that I could not go live. So this is being done from my laptop, and therefore the sound might not be as good as it ought. Apologies there, I need to investigate it, but I hope it's made sense. If you have any questions, please put that on our website, which is bbaws.org. I welcome your feedback and ideas. Thank you for joining me again. Welcome back if you've been here before. Welcome if you've never joined us. And I sincerely hope that you can join the Black Belt Academy of Surgical Skills next week as we talk about tying knots. I hope to have a new piece of equipment to give you a better view of what we're doing. Thank you very much for joining, and I think we need to have a round of applause to my assistant, Alistair. We're both training for our third down in karate at the moment, but it all comes back to the basics. And the very basic katas, isn't that right, Tokyosu? We do again and again and again, and no matter how many times we do it, we suddenly realize there's something else. And at advanced down level, we have to do it in reverse. And when I'm doing it in reverse, then you realize that the flow in the movement wasn't quite as you thought first time round. I'm not asking you to do an anastomosis backwards, but with practice and focus on getting it correct, I hope that rhythm and flow will come. Good day, good night, good morning, wherever you are in the world. Thank you for joining the Black Belt Academy of Surgical Skills, and be safe.